righty, let's see, it's 3:02. We seem to be sort of stabilizing in terms of participants. So I think we'll go ahead and get started. Welcome, everyone. My name is Hilary Godwin, and I'm the Dean of the University of Washington School of Public Health. Welcome to our bi-weekly webinar on COVID-19 and both the University of Washington's and the School of Public Health's response to the pandemic. Today, we decided to take a step back and discuss our schools, i.e. SPH's current plans, before returning to the classroom and the workplace, and address the contingency plans that we have and what decisions still need to be made. Joining me today is Juanita Ricks, our Director of Student and Academic Services. I'd like to start with a land acknowledgement. Although we are gathering via Zoom, we are all doing so on Indigenous lands. I am personally calling in from the Indigenous lands of the Suquamish people. And in Seattle, where many of you live and where we work, we acknowledge all the Coast Salish peoples of the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Wherever you happen to be tuning in from, I hope that you will join me in honoring with gratitude and respect the Indigenous peoples who are still here and on whose land we are guests. As members of the public health community, we commit to being better stewards of the land we inhabit than many of our predecessors have been, and to honor the good stewardship that the original inhabitants of these lands have shown. I also want to acknowledge that today is National Day of Awareness for Missing and Murdered Indigenous Women and Girls, and the final day in a week of action. And by doing so, I want to honor the work of Native families, advocates, and Indigenous nations who continue to rise up to challenge the silence, tolerance, and inaction in response to the crisis of missing and murdered Indigenous women and girls. I join many others today in wearing red to help bring awareness to this crisis. We will share with you in the chat box some links for attendees to learn more about this effort, and I certainly encourage you to check them out. As a matter of housekeeping, in case you haven't joined us in the past, these webinars are designed to keep our community informed and connected as we work and study remotely. And we welcome any alumni or members of the UW community who might be primary in other schools or people who are primary at other institutions. And while anyone is welcome to watch or take part, I did want to point out the guidance that I'm offering today and that we're talking about return to work and school in person really is specifically focused on the School of Public Health. So if you hear something and you're like, I wonder if that is relevant to me because I'm primary in some other unit on campus, I encourage you to talk to your dean or other folks on your leadership team. As a reminder, we use the Q&A function to post questions. So please feel free to post any questions that you have at any point in the Q&A box. We don't use the chat box to ask questions. We use it to share information. So we will periodically put links into the chat box. But if you likewise have resources that you'd like to share with people that are on the webinar, please feel free to put them in the chat box. So with that, I'd like to just provide a quick update in terms of where we are in terms of the pandemic and its impact on UW and SPH operations, and then we'll dive more into specifics about our plan for return to school and work in person. So as always, our hearts go out to those who have lost loved ones or whose loved ones are currently battling COVID-19. And I additionally wanted to call out that I know that for many of us, that it's not just the loss that we have from COVID-19 directly, but also the lost opportunities to spend time with loved ones, particularly ones who are near to end of life, and how this pandemic has really robbed us of those special times and important times with people that we care deeply about. So I just wanted to acknowledge that as well. Worldwide, there have been over 154 million confirmed cases of COVID, and global deaths total more than 3.2 million. You can't help but have noticed in the media the situation is particularly dire in India, where states are experiencing a huge second wave of COVID-19, and the health system is overwhelmed as hospitals and clinics are facing shortages of beds and life-saving supplies such as oxygen. While the news has really focused on that situation in India, we're seeing a very parallel situation in many parts of the Americas as well, including Brazil, which is also experiencing a new wave. So I know that for many of you, that you have family and loved ones who are in these regions, and that being so far away from them while they are dealing with this is, I can only imagine, incredibly difficult. So just wanted to let you know that we as a community are here for you and support you. And please not to hesitate to reach out if there's anything that we can do to help you. In the United States, things are starting to look a little better. We've surpassed 32.5 million cases here and close to 580,000 deaths. But the CDC projects a sharp decline in COVID-19 cases in the US by July if the vaccination rates continue to be as high as they have been, and if people continue to wear masks and physically distance when necessary. So we're on a very good trajectory. Of course, all of us are, so good news is that we have good availability of vaccines in the United States right now. We're obviously starting to see some of the impacts of both vaccine hesitancy and also unequal access to vaccine. And so there's still a lot of work for us in the public health community to do to make sure that we get as many people vaccinated as possible. In Washington State, DOH has reported more than 378,000 confirmed cases of COVID-19, almost 22,600 hospitalizations, and over 5,500 deaths. We were very much expecting, at least I was expecting, that King County and several other counties in Washington might go back into phase 2 this week. But what I at least was surprised by Governor Inslee's announcement on Monday to put a pause on the state's phasing transitions for at least 2 weeks. And that pause comes after recent data, including numbers from this past weekend, that showed that the fourth wave of infection that had been growing for weeks appears to be leveling off, and that it's clearly linked to the increasing numbers of individuals who are vaccinated in our state. On the vaccine front, Washington surpassed a key milestone last week. More than 5 million doses of COVID-19 vaccines have been administered in the state. And actually, as of now, we're at nearly 5.6 million. Huge thanks to all of you who have volunteered at vaccine sites, and certainly to our practice partners who have been working so hard to get the vaccine rolled out. So as of April 26, nearly 29% of people in Washington were fully vaccinated. We're doing substantially better here in Seattle and King County. And I think we're over 2/3 of adults have at least one dose in the city of Seattle. So just as a reminder, we're still seeing really, really good coverage, certainly for severe disease, hospitalization, and death for all known variants, for all 3 of the vaccines that have been authorized in the United States. So our message continues to be, and hopefully you will help push this out, that the right vaccine for you is the first one that you are offered. and that we really just encourage everyone to get vaccinated as soon as possible. That is becoming easier and easier. So we have a pop-up clinic tomorrow on campus, which will be at Alder Hall and Commons, and hopefully Ashley will put the link for making an appointment into the chat box. In addition, UW Medicine and local pharmacies and mass vaccination sites that are being run by the city are all now switching to have it walk-up appointments, not appointments, but walk-up vaccines available, as opposed to people having to register in advance. So really encourage people to take those opportunities, if you haven't already, to get vaccinated. Okay, so with all of that, we wanted to have a conversation about what do our plans for return to school in person and return to work in person look like. And I just wanted to thank everyone who participated in the listening sessions that we had 2 weeks ago. So we had 3 student listening sessions, 2 staff ones and 2 faculty ones. The staff and faculty ones were particularly well attended, and we're super grateful to the students who organized the student ones and provided a really great synopsis of those, the feedback that we heard from students there. We also really appreciated everyone who responded to the survey, which provided very complimentary data. And let me tell you a little bit about what we heard from people. So probably my #1 take-home message from the listening sessions was that we need to do a better job of communicating what's happening, who's deciding what's happening, and what those decisions are based on. We heard from a lot of people that they were overwhelmed with the number of email communications from different units across campus, but also that they were having difficulty synthesizing all of that information into a concrete sense of what does this mean for me as an individual. And also that many of the concerns that they had about safety protocols, about plans, were just not super clear or addressed in all of those communications. So it was with that in mind that we decided to pivot and use this week's webinar to focus on going through that plan and give people an opportunity to ask questions. And so what else did we hear? Other things that we heard were from a lot of people that the idea of coming back in person in the fall is making people understandably anxious. And also that the communication that the university plans to be predominantly using in-person instruction in the fall was also making people anxious, because they wanted to know that we were making and communicating about contingency plans if the public health situation in the fall doesn't permit us to be predominantly back in person. So those are all the things that sort of got melded into the talking points that I assembled to share with you guys today. So what I'm going to do is go through sort of what is the plan, and then Juanita has graciously agreed to serve as the proxy questioner. She has a list of questions that students provided yesterday, and then of course we'll be reading and monitoring the questions in the Q&A box to make sure that we're addressing questions that you guys have additionally. So let me start with articulating what the values are that are sort of core to the decisions that have been made both institutionally and at the school level that have led us to say that we are planning to be predominantly in person in the fall. So overall, our decisions within the school reflect the following sets of values. So one is, obviously, as a school, public health. The health and well-being of members of our community are our top priority. That being said, we also strive to be a school that is student-centered. So we are thinking deeply about how we are best able to provide a quality education and learning experience for our students. And then finally, we're also thinking about equity issues very deeply, because that, of course, is a core value for us. And specifically, the way that I've been framing that is thinking about making sure that our plans are informed by and reflecting the needs of the most vulnerable and marginalized members of our community. And I wanted to also emphasize that last part of community, which is something that that is really important as we think about this planning, which is us reestablishing ourselves as an in-person community. So unquestionably, the University of Washington is best at delivering education in person. I think people have done a fantastic job of pivoting during the last 15 months and providing online learning. But unquestionably, our strength lies in in-person learning. And that includes in-person community for engaging in discovery as well. So you'll hear a lot about this sort of emphasis on in-person. And I guess I just want to emphasize that that comes back to, again, this strong sense of we want to get back to structuring our community in the way that, that we work together best. Okay, so what's the plan? So presumably you have all seen that the fall course schedule assumes that classes will be in classrooms where there's normal occupancy. So normal occupancy meaning there's no requirement for physical distancing between people, and we're allowed to have 100% occupancy. We are clearly not at that point today. So if fall quarter were starting tomorrow, we would need to pivot and change. And likewise, if we get to the beginning of fall quarter, and for some reason we are not able to be at 100% capacity in classrooms, or we have distancing requirements, then we will likewise need to pivot to a different scenario. This 100% occupancy scenario was selected both because aspirationally that is where we would like to be, and also because we're getting very clear messaging both from the state and also from public health agencies that the pandemic is likely to be at a place where we have high enough levels of population immunity, so high enough vaccination rates in our community, and also low enough levels of circulating disease that we can reasonably expect that the requirements for physical distancing and for lowered occupancy will be lifted. Though that decision to lift the physical distancing requirements and to lift the reduced occupancy requirements are a decision that gets made by the governor. So right now, as has been the case for most of the pandemic, we are operating under guidance that was set by the governor's office in consultation with the Secretary of Health and other public health officials that is specific for higher education in the state of Washington. So all institutions of higher education have one set of guidance that we follow. And that guidance stays the same regardless of what phase that we're in. So that's how we've been operating up until now, and the reason that we have not been having very many classes in person or activities in person. Because of the trajectory that we see the pandemic on, we have reason to believe that the governor will, between now and fall quarter, change that guidance and likely will remove both the physical distancing requirement and also the reduced occupancy requirement. So we are waiting for that to happen. He's obviously not going to do that immediately because right now we're not in a situation in the pandemic where that makes sense. However, we do think that he will do it sometime in the next month or two, at the latest July, because we have other institutions of higher education in the state like WSU that need to go back to school before we do. and who are also operating under that guidance. So I know a lot of people are sort of like, well, when will we know for sure that this is the right scenario? We won't technically know for sure until we get that revised guidance from the governor. And if, for instance, he comes out with guidance that says actually people need to be 3 feet apart and there can only be 50% occupancy, then we, the University of Washington as a whole, will pivot and change all our classroom assignments in order to accommodate the new guidance. But we can't do multiple classroom assignment scenarios at the same time. And so as a result, this is the scenario that we decided, institutionally decided was most likely and are using for our planning scenario. But I want to be super clear to everyone that we, the University of Washington, will follow whatever the current public health guidance is for the fall. So anyway, keep on your radar screen. I would say sometime in the next, I would guess sometime in June or July, we should expect to hear from the governor's office about that new guidance. And that will be a point at which we will sort of be able to finalize and have greater certainty around the schedule. In the meantime, we ask that everyone assume that this is the plan that we will be working off of, and start to make plans for the fall accordingly. So what does that mean for individual faculty? That means even if you'd rather be in a classroom where there was room for 3-foot distancing between students, please do not ask for your classroom to be changed because we don't have enough bigger classrooms to accommodate everyone upsizing. And like I said, if we do need to switch because there's different guidance, we're going to redo the classroom schedules for everybody. So please sort of hang tight with your current assignment, even though it seems discordant with the situation that we currently find ourselves in. I also want to talk about what does that mean for all members of our community, this idea that we're going to be back in person predominantly. So in that scenario, I want to acknowledge that there are going to be individuals who are not going to be able to be back here in person. So we really want our students, including our international students, to do what they can to get back here in person because that's the best way, that's the best education that we can offer for the fall. That being said, I'm very aware that there are some countries where we have students where it is now not possible to get a visa appointment. And it may be that the time that's required or the wait time to get an appointment will be so long that those students may not be able to get back in time for the beginning of fall quarter. So I want to reassure those individuals that we are committed as a school, the School of Public Health, because we have a significant number of those students and because we care deeply about our most vulnerable members of our community, that we will make sure that you have access to classes. So what does that mean? Making sure that people have a remote option. We heard very loud and clear in the listening sessions from students that they would love for that remote option to be of equally good quality as the in-person instruction, and had a lot of conversations about whether or not that was possible. Where we have landed is that it is not possible for us to guarantee that for all of our classes. So while we would love to provide equally good remote instruction, the reality is that not all of our classrooms are configured in a way to permit that. And also not all of our instructors are prepared to do that. So we also want to be cognizant that our faculty too are tired and exhausted and are trying to figure out how they can get ready for the fall. So what I am asking all faculty to do is to provide some remote option. The default for most faculty, particularly those teaching in large classes, will be that they will need to record the lectures that they present in class, either using Panopto or using Zoom, and that those recordings and all of the course materials will need to be made available via Canvas to students who are not able to be here in person. So that's both for our international students who can't make it back in time, It's for perhaps our immunocompromised students who don't feel comfortable coming back to being in the classroom. And it's also for those students who might end up getting sick during the quarter and need to isolate or have exposures and need to quarantine. So it's really providing our students, again, from that student-centric position, with the flexibility that they need in order to complete our programs during what will continue to be a pretty challenging time. We hope that some faculty, particularly faculty in smaller classes, will say, you know what, I actually really want people to be able to participate even if they're remote, and I'm going to do a synchronous class where I'm mixing people who are remote online and people who are in person. And for those people, we are so thrilled if you are willing to do that. And we will communicate that out to students in advance so that they know that they need to be there for that time period. And we commit to those faculty who want to do that type of instruction that we will work with you to make sure that you have the technology and TA supports that you need in order to be successful. We are absolutely planning to invest as a school in additional TA support, similar to what we had this year with Will Sang, to help faculty get their classes recorded, to make sure that the AV systems are working. And also, if you need extra TAs in order to be able to do a high flex room, we'll work with you to make that happen. So I just wanted to be super clear, though, that faculty were asking of you to work with us to have that remote option, which can be as simple as a recorded lecture, materials on Canvas, and not having participation points, because there's some people who may be remote. Or it could be as sophisticated as working with us over the summer to figure out how to make it possible for you to do a synchronous engagement that allows for remote and in-person instruction. But the goal is that all of our students, regardless of whether they're able to be here physically in person, should be able to complete their programs. So that's for us, School of Public Health. I see Juanita sort of looking like, okay, we're going to have questions. Let's pause there. There's a whole separate section that's about staff stuff, but I kind of feel like, Juanita, maybe let's do questions at this point about classes.
This is so helpful, Hilary, and the framework, I think, is really a solid one that will help everyone with decision making. There were a number of questions that popped up in the chat and that have been coming in about distance learning. And of course, you mentioned that the plan for recorded lectures to be available for students is really designed for students who may have difficulty returning to campus due to location or health compromise. We have students who actually over this year have determined that they kind of like online instruction, or have made or found themselves in other situations due to family or otherwise, location, where they may opt and want to continue to attend remotely. So is that flexibility a possibility for students going forward?
Yeah, well, what I'm asking faculty is to let the students make a decision, both, someone to opt for the entire quarter or to opt for individual classes to switch back and forth if they want to between remote and in person. So it really is going to require the faculty to rethink like we have this year, whether, not having participation points unless you're making it accessible remotely to participate, so that students have that flexibility. And why am I asking that? Why am I saying really let the students make the decision? We really want everyone who can to be here in person, and we will continue to communicate that clearly. I really do genuinely feel that we can provide not only a better learning experience, but also a better sense of community for our students when they're in person. But we've also really learned over this last year that our students are struggling for any number of different reasons. And not all of them are ones that they are going to be able to proactively communicate to the faculty. We'd like to give them just for this, particularly this year, where it's still, we're expecting people are still sort of in this post-traumatic stress period and readapting to life, to just give people to sort of grace to make the decisions for themselves.
Thank you. There were a number of questions that came up in the chat and otherwise about safety. So questions like, will masking continue into the fall? How can we be prepared for this post-traumatic, stressful University of Washington campus? And will we have to make plans to have events outside of class? We've talked, of course, about classroom instruction, but the life of the university includes things well beyond that. And how can we plan, or should we expect that we'll have to put safety plans in place for everything that we do? So things of that nature, Hilary.
Yeah. So again, I think this is where it's helpful to clarify who gets to decide about what the policies are about safety. So the University of Washington, and this is one of the things that I've been super proud of us as an institution about, has been absolutely in step with local and state public health guidance throughout the pandemic. So we will continue as an institution to follow local and state public health guidance. And we have fantastic people at our local and state health departments. So I really, we're such a privileged place to be able to know that the guidance that they are providing us is evidence-based and makes sense. I'm sure lots of people were super excited to see that Anamari announced a vaccine requirement for students for the fall. You should anticipate to see something similar come out probably from the governor's office first for employees of institutions of higher education sometime in the next week or two. We as an institution, University of Washington, have held off on messaging about employees, which would be faculty and staff, until we understand what the governor's office will be pushing out for the entire state for higher ed. But expect there to be both requirements for vaccination, and also we've seen every evidence suggests that most members of our community intend to get vaccinated and are already seeking to get vaccinated. In terms of, we talked a little bit about the physical distancing requirements. Those are, again, something that is dictated by both the governor in the plan for higher education, and then concordance with local and state health guidance for higher education and also workplaces. For masking requirements, we haven't gotten a definitive signal about this, but I have to say everything that I've heard from Tony Fauci down to, not down to because he's still great, but through Jeff Duchin, is to expect to see masking requirements in place for schools and places of employment, probably for at least another year would be my guess. And that's just because we do have variants circulating, and then we know that the masks help provide that additional layer of protection. So I would say I'm anticipating that we will still have masking guidance in the fall. We're working really hard as an institution to communicate to people that even though you're seeing from the CDC guidance that says people who are fully vaccinated can gather in small groups with other people who are fully vaccinated without masks, that CDC guidance is about social settings. It's not about workplace settings or school settings. And so we still have, in workplaces and in school settings, do have absolute masking requirements for all individuals, regardless of vaccination status. And certainly I don't get to decide. It's not my, it's going to be the governor's office and the Secretary of Health and the health officials who decide whether or not that continues. But if I had to guess at this point, I would guess that that would continue as well. What did I miss out of your many questions, Juanita?
So there was the part, and I appreciate all of the questions about physical safety, both in and out of class. I would probably suggest that there was a portion which had to do with folks who arrived to campus without their vaccines in the fall, and whether or not they actually can participate. And then, of course, a related question that just arrived about folks who opt not to be vaccinated based on philosophical difference.
Yeah, so we are waiting for clarification from Central UW about how the vaccine requirements for students and for others will be implemented, and expect for that to be finalized in the coming weeks. So I don't have a definitive answer to what's going to happen to people who can't be or decide not to be vaccinated. What access they will have. That's something that we'll continue to receive guidance on. I do want to say we do understand, and that Anna Marie has very clearly messaged an understanding that we have students who are coming from other countries that have other vaccines that have been authorized, and also are coming from countries where vaccines are very scarce. So we've had clear communication that UW will accept vaccines that are authorized in other countries. So students who have, for instance, gotten vaccinated in China with a vaccine that's been authorized by the Chinese government but is not authorized in the United States, that will meet the vaccination requirements here on campus. And also that those students who don't have the opportunity to get vaccinated before they come back will have vaccine made available to them as soon as they arrive here. So we're having pop-up clinics now, but we will continue to have those pop-up clinics in the fall. But how we manage that sort of transition period while people are getting fully immunized, I just don't have the details on that at this point.
Thank you. And then the last part, Hilary, was about kind of less of the physical safety, but some more of the emotional safety and wellness of, life post isolation, post physical distancing, and this period away from campus.
Yeah, I think, I just want to acknowledge that this has just been, we're seeing elevated levels of mental health need in the state and the country and the world before the pandemic. But there's no question that the pandemic has had a huge toll on the mental health of most people. And that in addition, there have been other confounding factors that have differentially impacted members of our community. So for instance, I'm very aware that the violence that we've seen against Asians, against Blacks in recent months has been traumatic and disproportionately traumatic for many members of our community. So we just have a lot of people who are dealing with a lot. And that's not going to magically go away just because transmission levels decrease. So we will be working with supervisors and with faculty to sort of talk about how do we manage that on a day-to-day basis. I guess I would again urge everyone to treat yourselves as well as the other members of our community with grace to the extent that you are able to. And then also, Juanita, I would love for you to talk about Jen Wen, who's our newest member of the team.
Absolutely. It is my honor to mention that on Wednesday of last week, Jen Wen, who is a licensed mental health therapist, joined our team. So in partnership with the UW Counseling Center, the Schools of Dentistry and Pharmacy, Jen has joined as a professional to provide services for students, both in individual, group, and workshop settings around mental health and wellness, and also to provide some consultation and capacity building for the faculty and staff who support students to provide us with the competence to really help direct students to resources and when we're faced with students in crisis. And I guess I'll just take this moment also to acknowledge that it's Mental Health Awareness Month. And we definitely are happy to approach this service as one that we see in the full scope of wellness. So mental health is health, and we're glad to be able to promote student health in this way.
First of all, thank you, Juanita, to you and to everyone who worked so hard to bring Jen on board. It's been a long process, and we're excited. She's really fantastically qualified and will be a great addition to our support system for students. There was something else I wanted to say. Oh, I did want to mention too, one thing that we're constantly sort of taking stock of is in the midst of all the negatives of the pandemic, what are some best practices that have emerged that we actually think we want to continue throughout the year? And one that I heard from Denzel Sweet, which I really think is important, is that they've heard really loud and clear from students that the after hours access and the ability to talk to counselors via Zoom and other modalities, as opposed to having to see someone in person and go over to get in-person services, that students have found that to be really valuable. So he has reassured me that they are absolutely planning to continue those services, which I think is fantastic. And I would certainly welcome if other people, if there are things where in the midst of all the negative, if there are things that have been positive that you want us to continue, please do continue to message those to us. I'm noticing a couple of questions that are here. So one is about HVAC. I did get a lot of questions from people about, like, is the HVAC good enough? And so I went and asked Lou Cariello, who's the head of facilities, about that. And he said yes. So currently, all buildings on the University of Washington campus and that are used by University of Washington that are offsite meet CDC guidelines for air exchange and other requirements, HVAC system requirements for use during the pandemic. So he said there were a couple buildings that they had to put work orders in. Those have all been addressed. So if a building is open or your key card opens it, then it meets current criteria. And he said that's currently all the buildings on campus. I also see, yeah, go ahead.
There are a couple of questions that have to do clearly with instruction. Both, could you give a 60-second introduction to Hvac, and also how faculty can start planning for instruction around the divide between in-person and online students?
Yeah, so Hvac, and I'm sure Sarah Cave, I wish we had Sarah's panelists, would do a better job of this, but look, Hvac is using technology in a way that enables people who are remote to be able to participate in active learning the same way that people who are in person are. So you're using technology in order for the people who are remote to both communicate back and forth with the people in person, to hear what's going on, to contribute, and also to do small group teamwork. Not all of our rooms are really set up to do that. And I'll be honest with you, our big lecture halls are just not set up to do that. When we're looking at, like, that's part of why I said, really, I think our default for most of our classes will be recording of courses using Zoom or Panopto, and that people who are remote will have the ability to watch those recordings and to access all the materials via Canvas, which we know is not as good as an in-person active learning situation or a Hvac learning situation. That is part of why we're really pushing for, if possible, students to be back in person. We will be working, so we have gathered information about the capabilities of each of the classrooms. Over the coming months, we will be pushing out to individual instructors information about the capacities that are in the rooms that they're in, and talking to them individually about whether they plan to just do lecture recording, which is the default, to allow for remote participation, or whether they would like to do something more sophisticated along the lines of Hvac. For those faculty who opt for Hvac, we obviously need to make sure that the rooms are set up to accommodate that. It typically requires greater TA support so that you have someone who can be monitoring the people who are off-site. And in some cases may require some retrofitting of spaces. So those are all things that we're going to be working on over the summer to make sure that that we have those capacities. The goal would be that in advance of the beginning of fall quarter, that we would be able to have a schedule that we could share with students that clearly delineated for each of their classes, whether the remote option was an asynchronous thing like recorded lectures, or whether it was a synchronous option like Hvac. So we will be working across the units and programs to coordinate that with individual instructors, but I want to reassure instructors that we are trying to make sure that the default option is something that is reasonably manageable, which is the recorded lectures. Okay, I see someone saying there's only 15 minutes left in the staff.
Yeah.
So let's transition. Okay, so so what's happening in terms of staff? So presumably you guys have all seen, there was messaging that went out last month, maybe actually in March, from both Anna Mari and from Mark Richards, the provost, stating that the blanket allowance for individual employees to telecommute at will had been extended from the end of June, which is what they had said previously, until September 10th. So that extension was made with equity considerations in mind. So the leadership team for the entire campus recognized that, first of all, there are going to be people who won't have consistent access to childcare or don't know whether they will have consistent access to childcare over the summer. There are also individuals who may not yet have access to vaccination and may not be fully vaccinated. And then also there are all the individuals that we talked about who are just exhausted and stressed out and just need some time to sort of gradually come back to campus, or who need the transportation systems to come back online. So, or fully online, they're still there, but to be as regular as they were previously. So that was the reason for postponing that period until September 10th. We are waiting to hear and expect to hear in the next week or two guidance from Central Campus about what things will look like after September 10th. But I can tell you what I anticipate will be the case. So what I anticipate will be the case is that we will transition back to a situation where employees who want to telecommute will need to have individual telecommuting agreements in place, just as we have in the past. So you should really be thinking about the summer as your period of, you still have a great deal of flexibility, but dipping your toe in the water in terms of coming back, getting used to being back around people and figuring out with your supervisor what your work schedule for the fall should look like and getting that documented. I do anticipate that, because that's been our policy institutionally in the past, that those decisions will be made by supervisors in consultation with individual employees. However, I also very much expect that central administration will be providing more guidance about trying to be more flexible about where possible about who comes back and who in person versus allowing for more telecommuting. And also we as a school will supplement that as needed to help supervisors and employees navigate those conversations, which we've heard from a lot of staff they're pretty anxious about. So again, I would sort of view the summer as our transition period, and that you should be viewing the fall as sort of probably by mid-September, having in place those agreements that give you as an individual staff member the security of knowing that even if you're telecommuting, that you're being treated, you're not going to get dinged for telecommuting, that it's authorized. Are there other things, Juanita, that thinking back of things that we've talked about, staff transitions, that you think we should talk about?
How about any way that we sort of celebrate coming back together and into a new building? Those are a couple of things that have happened over certainly we moved. And then, yeah, I think that's a biggie.
Yeah, I'm also, okay, I'm going to come to that one. And I'm also reading from an anonymous attendee right at the top. This concern about open office settings. So we are still in a mode, as I mentioned, where we have significant restrictions in terms of density and also how physically close people could be, so physical distancing requirements. And in order to manage more people coming back, we are required by law, by the governor's office, to have plans that, for instance, stagger people who are in open office areas so that we don't have people sitting right next to each other. So please, if you are planning on coming back over the summer, maintain that open communication, not just with your individual supervisor, but also with your department administrator, so that we can make sure that we're adhering to the current guidance, and that we're not having too many people in too much close proximity while we still have distancing requirements. Someone also brought up worrying about custodial staff. That's another area we have low levels of coverage right now for most buildings in terms of custodial staff. And so that's another thing that needs to be ramped back up, and that we will be ramping back up over the summer. I share the concern that the person raised about the health and well-being of our custodial staff. One thing that's great is that the data that we have to date really does suggest that surfaces are not a major source of transmission. However, we worry about, of course, people who are required to be on site. And so absolutely making sure that the folks who are in those positions where they need to be physically on campus have access to vaccine and have good information about vaccines. In addition to having appropriate PPE, those are all things that are absolutely on the radar screen of their supervisors, who I've talked with directly, and also the campus as a whole. Juanita, you said we should celebrate being back in person. Yeah, so yes, absolutely. I think, as we start to see some of these social distancing constraints be lifted and more people are vaccinated, we absolutely over the summer will start to think of what are some gatherings that we can have to help people sort of dip their toe in the water of coming back to campus on person and reuniting with their coworkers and all that kind of good stuff. So yeah, I'd say right now, we're not in a good position to do that in terms of where we are with the pandemic, but over the summer months for sure. Someone asked if we could clarify about school level expectations for staff who want to telecommute, and whether or not it will be solely up to the department. So that is, again, we're waiting to hear from campus about what the campus-wide expectations will be, which we obviously have to adhere to. And my understanding is that they will encourage greater flexibility when possible, but also lay out what types of job responsibilities we would expect people to be in person for in the fall. And then probably we will do some supplementing as a school to those, but we need to see them before we can address that.
Sorry, I was typing. Let's see.
Questions too. We have 5 more minutes.
We do have a lot of questions about spacing and distancing and room capacity and one-on-one meetings. So still concerns about safety.
Yeah. So I just want to reinforce, we are not at a place right now where we are not at the place that we hope to be at the beginning of fall quarter or later in the summer. So when we talk about these are the things that we're looking forward towards, we are not there yet. So right now we still have 6-foot distancing requirements, and we still have limited occupancy requirements. And so we really are dependent upon all of you to do your daily attestations when you come in, to wear your masks, which I think you will continue to need to do, to stay home if you're not feeling well, even if you've been vaccinated. Those are all things that we're going to continue to ask you to do. But for the time being, we really, really need people to coordinate with their departments and their units about work in person, as opposed to just coming in at any point that they want to. So we are still absolutely in a very restricted phase. And we will continue to communicate with you guys as we start this, when we see those limitations being lifted. I see from AWA a suggestion we include healing activities when we return. I would love that. Yeah, so absolutely.
And one last question there, Hilary, about, I guess maybe it's not the last, but worst case scenario, if we're not where we need to be by fall, when will we start making the turn back or reverse course decisions?
Yeah, so I sort of see there's being 2 time points. One really critical time point and decision point will be when we hear what the governor's guidance is for higher education for the fall. So that could be as soon as the end of this month. My guess is it probably won't be until sometime in June, could be as late as July. I hope it's not as late as July. But when we hear that, we will be able to say more definitively of like, do we really think that the scenario that we have is realistic? Or do we need to shift to, for instance, larger classes have to be remote because there's some distancing or occupancy requirement that we don't have rooms that are big enough for that. So that'll be a key decision point. And unfortunately, we don't know when that announcement will come. And honestly, we don't have much control over it. So we will continue to be really clear with you guys when that announcement happens and what the implications of it are. But so that's sort of one decision point that I would say we're hoping is early summer. And then there's the second pivot point that's sort of an indeterminate pivot point, which is what I call sort of worst case scenario, which is right now we have great coverage from the vaccines against the variants for severe disease, hospitalization, and death. But could I imagine that there could be a horrible new variant where that wasn't the case? Of course, I could imagine that that could be the case. I don't think it's very likely. We're not seeing that right now, but it is possible. So if something like that happened the day before fall classes started or partway through fall quarter, absolutely, we'll need to pivot just like we did during the pandemic and pivot online. And none of us are happy about that. I think all of us are really tired of uncertainty and really tired of the idea of pivoting. So I just don't want, I want to be honest with all of you of like, we're not completely in the safe zone in terms of this pandemic. There's still complexities that could happen. That being said, I am personally, and I'm sort of known amongst the senior leadership team on campus as being like the voice of doom and gloom. But I'm personally actually pretty optimistic that things are going to be looking good in terms of the pandemic by midsummer and that we're going to be in a good place in the fall with all the caveats that we've talked about. But absolutely, we will continue to communicate with you guys about where we are and continue to do contingency planning to make sure that we're not caught off guard if something like that happens. So with that, we are at 4 o'clock. I'm positive we have not answered everyone's questions. Hopefully someone is capturing them. I'm looking, you don't know that I'm looking at you, but I'm looking at our comms team. And we will work on, so first of all, this will be recorded, so it'll be available online. We heard from students, they'd like to have a transcript. We'll make a transcript available or at least key takeaways like we've done in the past. And we will, if there are other communication strategies that people would like, please feel free to let us know. We heard loud and clear that you want better communication, and we are working on better communication and are definitely open to suggestions for going forward. So with that, I think I may just maybe we end there. What do you think, Juanita?
Seems reasonable.
Okay. So thank you all. I know you all have just been doing, double, triple time in terms of covering everything, and that people have had extraordinarily difficult personal situations. I'm incredibly proud of all of you for the just tremendous work that you've done and resiliency that you've shown. And please call on us if you need assistance with things and let us know how we can help you. Thanks.